Cellular adaptation. Let's say this is a cell. Sometimes changes occur in a cell up to a point that from where it is reversible to normal. Such changes are called cellular adaptation. But sometimes cells are so severely stressed that it loses its adaptive ability, and this condition is known as cellular injury. So, cellular adaptations are reversible changes in the size, number, phenotype, metabolic activities, or functions of the cell in response to change in the environment. Whereas cellular injury means when cells are stressed so severely that they are no longer able to adapt, or when cells are exposed to inherently damaging agents, cellular injury results. Types of cellular adaptation: hypertrophy, hyperplasia, metaplasia, atrophy. Here, hypertrophy and hyperplasia both results in increase in size of the organ. Hypertrophy means increase in size of the cell, whereas hyperplasia means increase in number of the cells. Metaplasia means replacement of one cell type into another cell type. For example, here squamous cell is replaced by columnar cell, and the atrophy means decrease in size of the cell. Now let's talk about hypertrophy. As mentioned earlier, hypertrophy is an increase in size of the cell that results in increase in size of an affected organ. It can be classified in two types. Physiological hypertrophy is a normal phenomena which occurs without any pathology. For example, hypertrophy of the skeletal muscle due to exercise, like in bodybuilders, hypertrophy of the uterus during pregnancy, hypertrophy of the breast during lactation. Pathological hypertrophy of the cardiac muscle due to increased workload. Now the causes of hypertrophy are increased functional demand of the organ or excessive stimulation of specific hormone. So basically, increase in protein synthesis in a cell causes hypertrophy. Now let's come to hyperplasia. Hyperplasia is an increase in number of the cell in an organ or tissue in response to a stimulus. Hyperplasia can be classified in physiological hyperplasia and pathological hyperplasia. Inside physiological hyperplasia also, in hormonal hyperplasia, glandular proliferation of the female breast at puberty and during pregnancy, or hyperplasia of the pregnant uterus. And compensation hyperplasia means in case of partial hepatectomy, the remaining part of the liver regenerates by the process of hyperplasia. Pathological hyperplasia means increase in the number of the cell due to pathological condition. For example, benign prostatic hyperplasia. Now the question comes, what are the organs where both hypertrophy and hyperplasia occurs? It is uterus and breast. Now the very important thing to understand is there are three types of cell according to their regenerative capacity: labile cell, stable cell, and permanent cell. Labile cells are those cells that continuously keeps regenerating, for example, epidermis and hematopoietic cells. Whereas stable cells are those cells that are present in the G0 phase, means they do not divide, but they can divide whenever it is necessary. For example, liver cells. The permanent cells are those cells that have no regenerative capacity, for example, neurons and cardiac muscle cells. So here the thing to understand is in which type of cell does hypertrophy occur and in which type of cell does hyperplasia occur. As we know, in hypertrophy there is increase in size of the cell, not the number. So the labile cell and the stable cell, they have ability to regenerate, but the permanent cell do not. So hypertrophy occurs in the permanent cell, whereas hyperplasia means increase in the number of the cell. And as we know, stable cell and labile cell can regenerate and can multiply, but the permanent cell cannot multiply. So the hyperplasia occurs in stable cell and labile cell. Now, metaplasia is a reversible change in which one differentiated cell type is replaced by another differentiated cell type. Here, we cannot use the term converted or transformed. It is replaced. Now, the types of metaplasia are epithelial metaplasia and connective tissue metaplasia. In epithelial metaplasia, there is squamous metaplasia, means columnar cells are replaced by squamous cells, and columnar metaplasia, means squamous cell is replaced by columnar cell. Now, the examples of epithelial metaplasia are in squamous metaplasia. As we know, the lining epithelium of the respiratory tract, that is pseudostratified ciliated columnar epithelium, in case of the chronic long-time irritation of the smoking, it can be replaced by squamous cell. Columnar metaplasia. The lower part of the esophagus lined by squamous epithelium can be replaced by columnar cell due to continuous reflux of the gastric acid. This condition is called Barrett esophagus. In case of connective tissue metaplasia, there is formation of cartilage, bones, or adipose tissue or any other type of connective tissue in the site where normally this tissue do not exist. For example, bone formation in the muscle called myositis ossificans, which usually occurs after bone fracture. Now the last topic of cellular adaptation, atrophy. Atrophy is defined as a reduction in size of an organ or tissue due to decrease in the size or number of the cell. Now once again, atrophy can be classified as physiological atrophy or pathological atrophy. In physiological atrophy, it is atrophy of notochord or thyroglossal cyst and the uterus decrease in size shortly after parturition delivery. These are normal physiological phenomena. Now, in pathological atrophy, there is localized and generalized. In localized, it may be due to denervation atrophy, disuse atrophy, or pressure atrophy. And in generalized, it can be due to starvation. Now, as we knew, hypertrophy occurs due to increase in protein synthesis. Similarly, here, atrophy occurs due to decrease in protein synthesis and increase in protein degradation in the cell. Some important causes of atrophy are decreased workload, which is known as disuse atrophy, loss of innervation, that is denervation atrophy, diminished blood supply, inadequate nutrition, loss of endocrine stimulation, and pressure atrophy. So this is all about the basics of the cellular adaptation. I hope the video helps. Thank you for watching.